Welcome back to Achievio. I'm so glad you're here. Today we are tackling a cornerstone of pharmacology, routes of administration. Understanding these routes is essentially about learning the different paths a drug takes to reach its target site. As future healthcare professionals, the route you choose affects everything from absorption speed to patient safety. We'll be mastering the big five: oral, intravenous, intramuscular, subcutaneous, and topical. Each has a unique clinical rationale. The first concept to master is bioavailability. How much of the drug actually reaches the systemic circulation? While IV drugs have 100% bioavailability, oral drugs are often reduced by the body's natural defense systems. Let's start with oral administration, or PO. This is the most common and convenient route for patients. Once swallowed, a drug must pass through the stomach acid and enter the small intestine to be absorbed. But remember the first pass effect. The liver metabolizes a portion of the drug before it ever reaches the heart. The pros? It's cost-effective and non-invasive. The cons? It's slow and requires a functional digestive tract. Now, switching to the fastest route, intravenous, or IV. This goes directly into the venous system. Because IV bypasses the GI tract entirely, the drug's onset is nearly instantaneous. This is vital in emergencies. In critical care, we use IV for immediate action. But beware, once it's in, you cannot take it back. Always double-check your doses. IV errors are immediate, so precision is your best friend in the hospital. Moving to intramuscular, or IM injections. These deliver medications straight into the deep muscle tissue. Muscles have a rich blood supply, allowing for medium-speed absorption. Faster than oral, but slower than IV. Common sites include the deltoid, ventrogluteal, and vastus lateralis. Perfect for many vaccines and hormones. Next is subcutaneous, or SubQ. These injections go into the fatty tissue just under the dermis. Because adipose tissue has fewer blood vessels, the drug is absorbed slowly and steadily. Think insulin or heparin. Depending on the patient's size, we use a 45 or 90-degree angle. And remember, rotate those sites to prevent tissue damage. Our final stop is topical administration. Creams, gels, and transdermal patches applied to the skin. Most topicals act locally, but transdermal patches pass through the skin for a systemic, whole-body effect. Nursing alert: always wear gloves when applying topicals. You don't want to absorb the patient's meds yourself. Let's put it all together. From the instant speed of IV to the steady release of SubQ, every route has a purpose. Mastering these is your first step toward pharmacology excellence. Study this table. It's high yield for your exams. If this helped you, join our community of future nurses. Subscribe to Achievio and hit that bell for more study hacks. Thanks for watching. Stay focused, stay curious, and I'll see you in the next pharmacology lesson. Bye for now. Connect with us on social media for daily tips. Achievio, where future nurses become nursing legends.